Well, Jayne, thank you so much for coming to the podcast, and apologies about us being late.
That's all right.
For our listeners, can you introduce yourself for them and tell them where you work and all that good stuff?
Sure. My name is Jayne Gaddy, and I work for the Anxiety Center of Houston in the Pearland location. There are 3 locations of the Anxiety Center. It originated in the location of Houston itself, up in Northwest Houston, and Dr. Burkholder started the Anxiety Center there, I believe, in 2015, and then she opened up another clinic in the Woodlands in 2019, and then opened this one here in Pearland just this past January.
Awesome. So y'all recently just moved to the location in Pearland, right?
Yes, that's right. We opened here as far as trying to begin to build clientele in Pearland in January, but rented offices at another location in Pearland while she was finishing out the location we are now permanently in on Shadow Creek Parkway. And so we moved into that now settled clinic in August.
Very nice. How long have you been practicing?
Well, I myself have been doing it for over 30 years. I was in Austin for most of those years in private practice, and then took this position at the Anxiety Center in the Woodlands location almost 2 years ago now. And then Dr. Burkholder asked, with her knowing that she wanted to open up the location in Pearland, she then asked if I would agree to be clinical director here in Pearland as she was opening up this location. So,
that's awesome.
Yeah, so shifted from the Woodlands to here.
Yeah. What made you want to get into this field?
That's a great question. That's not been asked of me in a long time. My father was a surgeon. So I grew up in the medical field and often assisted him back in the days when there wasn't HIPAA. So I could assist him in surgery, and did that on and off for lots of years as I went through college, and had thought I would go into the medical field because I had been brought up with just being in hospitals a lot and caring for people, and knew that I always wanted to work with children specifically. So I remember thinking along the lines of pediatrics and would I want to be a pediatrician? And he very wisely had me speak with a friend of his who was a female pediatrician. And I talked with her just as an informational interview to find out what is life really like as a female pediatrician who wanted to have a family. So this was well before I majored in pre-med for a couple of years until I had this interview with her. So I talked with her about it, and basically she educated me about the realities of it. And I recognized that with talking with her that I wanted to do more work with children that really impacted them and built relationship with them. And as a pediatrician, as you know, whether you remember going to one when you were kids or if you've got your own, there's not a lot of interaction that you have with the actual pediatrician. It's more with the nurse, and the pediatrician comes in and assesses, but you don't really bond with the child, with the doctor. So I knew there was some other path that I wanted to go on that wasn't necessarily in medicine, because she also talked about how very and I knew this growing up too, that doctors don't have lots of family time because they're busy at the hospital instead of being able to have family time. So I had grown up studying piano, and had found out as a senior in high school about this new track of training with children, working with children, that was called music therapy. So I looked into that after I graduated from high school and went to Texas Women's University, where they had this new major that was music therapy. So I could use my piano skills, and I love music. And so using it with children and the power of music with them, whether in movement or how it can help us just soothe ourselves or stir up. You guys know, it stirs up sadness if you listen to particular songs, or anger if you listen to particular kinds of music. And so learning and studying the power of music and how we can use it therapeutically with children was the way I started into this field. But Texas Women's University doesn't have guys there, not very many. And I was 17 when I headed to university and wanted to date. And it was a campus of 7,000 women and a few guys. But my sister was going to college outside of Chicago at a school called Wheaton College. And she was a year ahead of me, and she was enjoying there, and lots of guys were there. And so she suggested I transfer. So I transferred from Texas Women's University up west of Chicago at Wheaton College. And that's where I majored in psychology and pre-med, because they didn't have a music therapy major. I decided to go along the track of psychology. Was thinking pre-med at the time, like the pediatrician track also, but also continued my piano studying there, thinking I'd then graduate and then meld the two and get more training in music therapy. Still had that vision. Anyway, decided that with so many years of piano, and I have a bad back, so that's not a great combination. How many hours you got to practice piano and have a bad back at the same time? So I'd had so many years of that I decided I'm going to drop the piano, so to speak. I'm going to drop the studying of the piano and continue with psychology, because it was just beginning to really fascinate me. And I was recognizing that this would be a field that I could build those relationships with the kids that I had always wanted to do in a profession. I had an internship that was required for my bachelor's that I chose to have in a mental health facility that was just with kids. So I specialized in the treatment of children as I continued in my education, and chose internships that were particularly just with children or adolescents. And as I continued through my master's, I kept that up as well, to just specialize in that population, and recognized I could become a therapist. I can integrate the music when I want to, but didn't need to particularly specialize in that. And so that's how I became a therapist, is I just continued with that training that was going to be specializing in helping little kids and adolescents.
That's interesting. Was there I feel like today, children deal with a lot more anxiety, depression issues. Was it that prevalent back then too?
It was not. That's a great question, because I got my degrees I got my master's in 86, so mid 80s, and then started into the field working at a therapeutic day school with severely emotionally disturbed kids, but then moved more into an outpatient setting where it's not as intense as far as the psychiatric disorders. When you're choosing to do outpatient therapy, it'd be like me choosing to go to a therapist, not because we really necessarily need it as far as the mental disorder. And so I had that exposure to people who were choosing to come to therapy, as opposed to they had to have treatment. And in that milieu that was the outpatient clinics, children at that time were coming to see me for things like adjustment to divorce, loss or grief, if there had been a death or even the loss issues that happen with divorce. Children were coming to see me for therapy for recovery from sexual abuse, some attention deficit disorder. That was more the kinds of population that I saw in those late 80s, early 90s years. And then what I recognized, and it was so striking, when school shootings began, that's when I saw an uptick significantly in children being brought in for therapy in response to this fear and anxiety about going to school. And so those diagnoses regarding anxiety really began to show up much, much more.
Yeah.
And then, of course, as we know, through the 90s, and then 2001 hits with 9/11. So just these historical events that have happened where our kids and teens are, and we are too, but with my specialty with kids and teens, seeing them try to manage the world and then school, with then seeing cops that were walking around in the hallways that they never had to see before, or metal detectors, or how things radically changed for us all with air travel and what our kids see. I remember that so strikingly just after 9/11, going to the airport and, the striking difference about us just being able to get past the entrance gates where you get your tickets, right? And then our kids being to our side and seeing the cops with their rifles in the airport at the time. So these anxiety disorders have for sure grown. Then we come to this year, of course, with the pandemic, and the number of anxiety disorders and depressive disorders have absolutely increased.
Yeah.
And since your years of practice, have you seen more categories kind of spring up, like different names of disorders, since we have new things being introduced into the world, like the internet, social media, things like that? Have things evolved since you started practice?
They have shifted, not necessarily diagnoses that have changed in the labeling of them, because the diagnostic manual that we use to label diagnoses is a particular manual that is revised maybe every 5 to 10 years, maybe, with a little bit of tweaking here and there as society shifts. So on paper, if I'm writing out a diagnosis of someone, those diagnoses would be the same labels pretty typically across these past 30 years. But we are seeing certainly like kids with addictive behaviors in regards to the internet, where 30 years ago, of course, we didn't have it. So I wasn't seeing kids that were addicted to their phones and spiraling in their schoolwork because they can't get off their phone or off of the internet. So that certainly has shifted regarding what it is that is causing the diagnoses.
Yeah.
So that for sure has shifted.
Have there been any long-term studies, or what's the long-term impact of kids being addicted to cell phones and social media, and then how that plays out into their late 30s, early 40s? Like, what do those people actually come out looking like in the long run?
Sadly, we haven't had it around long enough to be able to do those long-term studies. When I think about the age of my oldest two kids, 31 years old and 28 years old, they didn't have a cell phone until toward the end of high school.
Yeah.
And so for us to see what is this impact that has been on them through their 20s as they go into these other decades, we're not sure yet. And if we shift those ages down and think, okay, if those now early 30s started when they were in their late teens, which even then, remember when it was like the texting that was just...
the Nokia phone,
Yeah.
the Nokia that you
The
could play
T9.
Snake on it.
The T9, we have to hit the number 100 times.
Yeah, right? And so even that has morphed so dramatically for kids that are coming up in age. And what's sad to me as a therapist with kids and teens and trying to help parents become the best parents they can be is how society has sent the message to parents that our kids need to have this technology, as opposed to recognizing how dangerous it is for those young brains.
Mike and I talk about that all the time. When we didn't have, I think we probably had a phone. I think I was a junior or senior or whatever, and I think it was similar to you. So you're spot on with that. And also you said something about society making, it's almost abnormal if your kids don't have a cell phone.
Oh, yeah.
The other thing, too, that plays into it is if their friends have the devices, parents almost feel obligated to give their kids because it's not fair.
They can't text each other either. It's strange. But I mean, I think we had the same kind of addictions, but we don't have it right at our fingertips. We used to have TV. We'd have to wait for certain shows to come on. The radio, you'd wait for the song to come on. Yeah. Now you get everything when you want it, So I think it's like a different kind of addiction, because now that you've looked up everything, now you're like, what's the next thing? What's the next thing? What's the next thing? So
that's the wild thing about the technology and how those that are building these, whether it's apps or the social media platforms, that they're studying neurology so that they are feeding that addictive cycle in our brains purposely, so that they keep us hooked on, I'll keep scrolling on Instagram. Yeah. Because it kicks that dopamine or, happy chemical in our brains. And what's so frustrating as a parent is that's the design of this, is to purposely get us all, I've got to have that next, notification that so-and-so has responded to my email or something. Yeah.
So they can sell to everybody that has a phone.
Yeah, that's right.
What are some unique ways that yourself and the Anxiety Center of Houston help to treat maybe the severe cases of anxiety? So severe cases, I know anxiety comes in all forms and shapes, and it's all different, but I guess what I'm getting at is, do y'all focus on maybe the children or the kid is on a phone too much? Do y'all prescribe, like, they need some vitamin D, some sunlight out there, they need to eat better? Do y'all do stuff like that too? And when you're helping someone work through towards, depression or anxiety?
If I hear your question the way that you're asking it, let me know.
Okay.
In the process of therapy, we are providing, let me back up. Different therapists have different styles.
Right.
And so some therapists would be very direct about those kinds of ways to help and give a client maybe specific directions or instructions about these are things to do. Other therapists may be much more reflective, and their style and their training may look more like you would see on movies, where it's more, the session is a lot of the client talking, downloading, putting pieces together, and the therapist might be reflecting what the client is saying and not as much directive to help them out. So most therapists, I believe that if they are good at what they're doing, are going to try to get to know the client regarding what it is that they are wanting from the therapy experience. Some clients come and they really want a listening ear, somebody who's empathic and really can come alongside them with their pain, hear them for perhaps the first time in their lives about what it is that they're experiencing life like. And then there are other clients who come in and they really do want those practical ways to manage anxiety. They may come in the first time and say, that's one of my goals is I'm experiencing so many anxiety symptoms. Please let me know what to do about it. What are the tools in the toolbox that I need to know so that I can manage this better? Yeah. So a good therapist is going to hear from the client as they get to know them in those first few sessions, what it is that they are wanting from therapy. And even if I believe it would be more effective and you'll feel change better if I give you the handbook,
right?
That may not be what you're there for. And so, yeah, effective therapists are going to take the client's lead about that. When parents bring their kids to therapy, it depends on what the diagnosis is and what the presenting issue is regarding what kind of therapy you're going to present. So if a child is dealing with grief of a grandfather, then that's going to look, the therapeutic process is going to look very different than it is with a child who comes in and has an addiction to said technology.
Right.
That would be much more where the parent is saying, help me, help my child not have such an addiction to what this is. So those kinds of situations, they're going to look very different if you had a hidden camera about what's the therapeutic experience look like.
Yeah.
But with what you're saying regarding anxiety, and when people come in with this overload of that stress response that we have to things that are so stressful, then most therapists are going to get to a point in their therapeutic relationship where a client naturally wants to then know, now how do I deal with it?
No.
If they've, hung in there long enough in the process and maybe have worked through what are the causes of the anxiety and have reflected and maybe get to a point without them knowing it at the beginning that they really need and want some tools to more effectively manage this anxiety.
Yeah. Mike and I talk about, I think Mike deals with anxiety. I deal with anxiety probably a little more intense than Mike does. What I have found that helps me, and I think Mike does the same, is like diet and exercise. It's probably a lot different than kids, but people in their 20s or 30s or 40s dealing with anxiety, a tremendous amount of caffeine, dairy or something. So right. Does that get talked about too?
Absolutely.
Okay.
Yeah. Again, and I can say that I would.
Yeah.
I can't say that all the therapists would, but I certainly do believe in educating so many clients about the various things that we have within our control that can change. Things like our nutritional intake. How is our sleep? Are we getting enough sleep? Are we exercising regularly? Do we have exposure to sunlight? Are we being careful about caffeine intake, alcohol intake, sugar intake? So those kinds of things I certainly address and educate. A lot of times we think it's obvious.
Yeah.
People should know that, surely. That, this is what the definition of a healthy lifestyle is, or this balanced lifestyle. But so many don't. And so to address that and say, these are things that are within your control.
Let me shut that up. You keep going.
Yeah.
We're just going into rave mode.
Yeah.
That's right. It's the disco light.
Yeah. I think you hit you made a good point, so it just went off.
I wanted to respond.
All right, yeah. We have sensors in there that tell good points from bad points, so you did a good one. I was going to ask you, so do you have any can you share any like breakthrough cases where you found the trigger? I know, like you said, anxiety is really complex, and when you get older, it gets even more complex with stress and your life. I mean, just so much stuff stacked on each other. But is there ever just a moment where like you're like, oh, this is what's causing it, and then someone takes it away or adds it, kind of thing? Is there any instances like that?
Well, many people, many adult clients come with these anxiety symptoms that are manifesting, and they often don't recognize the importance of going back in time and talking about history. They want to know about the now and what to do about the now. Understandably, they need and want a quick fix to what it is that's going on within them so that they can manage the work setting better or a relationship better. So a part of therapy is trying to help clients understand why is it in therapy that we do take a client back and talk about history, slowly talk about significant events and changes that have happened in their lives so that they can begin to make those connections regarding what happened in the past that has added to who they are or has assisted and directed who they are and how they're responding in the now. So a part of therapy that I take my clients through is I talk with them first about causes of anxiety. And I talk with them about the three main factors. And I say something along the lines of, if we did a circle graph and we divided it into three sections, one of those sections that is a cause and a factor of anxiety is our genetics. So I talk with them about if they know any history of relatives that have struggled with anxiety. It often is a generational issue.
I didn't know that.
And so to talk with them about, did they notice that in their parent, or do they have a sibling that also struggles with anxiety, or an aunt who, they knew in the family had struggles, but they're not labeling it because of family secrets. They're not labeling it as, a real concern in mental health. But as they divulge that and they recognize, well, number one, maybe they're a client that says, oh, I've struggled with anxiety from the time I can remember. So it wasn't just since last year, but, all my life I've kind of, had this nervous stomach, and my parents tell me that I was nervous about going to school every day. So, historically they maybe have struggled with it for a long time, but they also recognize, well, my mom also struggles with anxiety too. So they're recognizing a genetic component. So that's part of our circle of the three main factors of anxiety, is trying to assess, okay, what percentage of that circle is genetic? Okay. Then another part is parenting style. And if you think about, there are three basic parenting styles that can also contribute to and add to kids feeling anxious. One would be an unpredictable kind of parenting style. So if, for instance, a child is being brought up in a home where a parent is alcoholic and the parent is very unpredictable about how they're responding from day to day, and the child doesn't know, is my dad going to be drunk tonight, or is my mom going to be rageful when she's been drinking, or is she going to be calm? Or is dad going to be just chill and just fall asleep on the couch? This living with unpredictability, as you can imagine, for a kid, that starts those brain pathways of be anxious, be very anxious, because you don't know what her dad or mom going to be like tonight. So they're just kind of walking around on pins and needles when it's unpredictable. Another parenting style that can cause and contribute to anxiety disorders is one where they're overly cautious, overly protective. So imagine a mom or dad with a child at a playscape, and you're seeing the child is doing what kids do. They're exploring with their body. I'm going to go up this, ladder of the slide, and the mother or the father are careful, careful, careful.
Yeah.
Right. And they're sending that message from an early age about be very afraid, be so careful. And so that
Helicopter parents. Huh?
that also adds to that. And then the third form is over controlling. So if you are the one who decides that this is the way my child is going to dress, this is the way that their hair is going to be, and their self-expression is not accepted, and that kind of over-controlling parenting can also cause those anxious kind of pathways in their brain.
So I can blame it on my parents. Thank you, Mom.
A lot can be.
And Lee know his.
Thanks, parents. No, I was joking.
Well, but some clients, when they recognize what's going on with the parenting in their background, they realize, there's really not an element there. Like my parents weren't one of those three particularly, but they recognize lots of it's genetics. And then the third component is trauma. So if you recognize that, okay, all of us go through shifts and difficulties in our lives. Some interpret a difficulty with more of a traumatic response to it. Maybe a sibling that you compare yourself with where they did fine with that, but I was like freaked out about such and such an incident. Just that response to a difficulty is big and can add to those anxiety pathways in your brain that contribute to, if we don't deal with the trauma, it's just going to build on the other stressors of life. And we're just moving on because with trauma, mostly we're trying to survive the trauma. We're not taking the time to feel, how does it feel in the midst of that trauma? We are simply surviving. So we keep moving on in life. Maybe another trauma happens. Maybe another significant event or loss happens. And we get into our 20s and 30s and we start manifesting these symptoms that are anxiety symptoms or depressive symptoms. But the now is not equating with how much we're feeling. And so when we take a client back and they start recognizing, I never dealt with that particular trauma. It happened when I was 10. My parents divorced. I just continued on. And I had to because I had to survive. And so in the therapeutic process, you take the client back to that time where they're then in a safe environment. It's not happening.
Yeah.
They're now 26. They're not 10. But they know that in their psyche, that they're in a safe place. We've established a safe relationship in the therapy setting. And then they can start to relax, go back into that moment or moments and trauma and feel it and connect the feeling with the event and then put it back into their memory without so much angst and trauma.
Yeah. You mentioned something about the crazy aunt. I have a crazy aunt, but that's not what I'm getting at.
That's it.
That's all he's saying.
Yeah, no.
Just putting it out there.
It made me think of back in the day. It was a lot more shameful, I guess, to admit anxiety or to say you have a mental health disorder. Yes. I feel like these days we're making progress, and I don't know if it's normalizing is the right word, but we're saying, okay, hey, anxiety and depression is a real thing, and there's real ways to treat it. I think it was it was shameful to have it in the past. Yes. Are you seeing that compared? I mean, in your years of
so much
profession?
More accepted now.
Yeah,
so much more accepted. Excuse me. I think even that Dr. Burkholder named the clinic the Anxiety Center of Houston, really does speak to how much more accepted it is. And with just the name of it, I've reflected this to her too, that I think it was such a well-named place for people to seek help that they want or need, because we all deal with anxiety.
Yeah.
All of us on some level or another. And so to call a place and ask for help because of the experience of anxiety at whatever degree that the person is feeling it, there's some accepting and some validation with just the name of the place. And yes, people are calling with more of others and society accepting that there are mental health issues that we deserve to recognize and deal with, and that it's okay.
Yeah.
Take off the time from work and get to your therapist once a week. And it's as important in our mental health as it is for our physical health, and so on.
Yeah, exactly. Is there any data showing what races or what like men to female ratio deal with anxiety more? Like, well, I guess we can start with the male to female, but then move to maybe races. So from a male to female perspective, who deals with mental health a lot more?
Well, there are statistics that I don't know specifically in answering your question, but what I can speak to is certainly more women pursue therapy. We wish more men would, but women are more, whether it's upbringing, whether it's natural, whatever reason, more women speak about their emotions naturally than men do.
Yeah.
Again, is it cultural? Who knows why, but it's just factual that they do. And so more women are clients, as well as more therapists are women. Because of that, I think it's certainly so often due to our upbringing. If you think about girl versus boy, classic stereotypical toys, you think about how girls are being brought up with dolls that interact with each other, and boys are dealing with cars and building things, and maybe doing a play alongside their friend, but not necessarily interacting with that friend with that particular toy. So girls are being brought up even through their play in ways that is very much more interactional and emotions that are being spoken, pretending they're the teacher, pretending they're the family, and they're going to take their Barbies and have their little camp time. Whereas guys are not brought up with so much of that. Let's talk about feelings and emotions and relationships. And so women more often are the ones that are calling for the help. And in answering your question about percentages and so on, I'm not sure about is who's in therapy reflective of the culture and how many are dealing with anxiety? Yeah. I doubt it. I just think that there's a whole lot of guys that are dealing with it, but don't feel that same comfort level of, I'm going to go talk about it.
Right. No, I think you're spot on. I think it's not masculine to talk about your feelings or to deal with emotional issues. So I think you're spot on.
I think that's changing too, though.
Yeah, I think so.
Thankfully, right?
Yeah.
Thankfully.
It makes your job easier, right? When people start talking, it's not so hard to crack them open. I think anxiety holds so many different emotions too. It's because it's like, it's like stress is anxiety, worry, excitement can be anxiety. I mean, it's just anxious. Because I was talking to Jon. Sometimes I would drink coffee and I get excited, but I could flip it into anxiety real quick.
Yes.
If I think about it too much, I'll start worrying. And then I'm like, oh, crap, now I'm in an anxious state rather than that cool, exciting state where I could been productive or ran or whatever.
Energetic.
So it's almost like if you don't use that energy, it could turn into anxiety.
Yeah.
What do you think about that?
I think that's so true. So much of work with people that struggle with anxiety is about how we think. Being careful about what is it that we are focusing our thoughts on, and that what we're thinking about is going to affect our emotional state, right? If you think about happy things in Christmas time, then you feel better and lighter and more positive. And if I'm thinking along the path of depressive thoughts or listening to depressing music, and I'm thinking about, something in my past, then I'm going to feel that way. So many times with people in therapy, but even more specifically about anxiety, even if they feel that energy that you're talking about with a caffeine, if they think about it differently, then it shifts their experience of it.
Yeah.
And if they can flip it back and go, now, wait a second, I'm not going to start thinking about anxious things. I'm going to use this energy that I feel in my body to, I'm going to think about it positively, and that it's going to help me in my productivity. Yeah. So much about work with people who struggle with depression and with people who struggle with anxiety is about what's going on in your head and how are you thinking about things.
Yeah. So I want to know, like, with the news and how they just pump this kind of negative stuff, or then social media does better when it's kind of negative. Psychologically, how is that affecting us from day to day? Because I'll read news articles and I'm like, and they'll pop up, and I want to click them and read them and see what bad is going on, just so I can like prepare myself. And social media is the same way, but like, and I find myself getting in more anxious situations, headspaces, and I'm just like, if I stop this, it'd probably be good. But I feel like this is actually doing damage. Like, I feel like my chest is a little heavy. I'm carrying a little like weight whenever this is happening. What is that from a biological standpoint?
Well, that again, I think really speaks to that connection of what we're thinking about affects our emotional state. So if I'm looking at kittens or those little videos that are two little babies that are laughing together, then that affects my emotional state. And with more and more of the news that is so depressing, back in the day when we only got our news either at the 5:30 time on television or a newspaper, maybe listen to radio, but I didn't grow up with National Public Radio. I grew up with just radio. Every once in a while there's like a news weather forecast or something, right? And then the pop 40. Yeah. But now we have it at our fingertips, this constant stream of what is going on, and what's newsworthy are negative, fantastic kinds of stories as opposed to the happy kittens.
Yeah.
So that's our news feed. And I have often talked with clients about putting the phone down, limiting what their news intake is, especially during the pandemic, where people are locked away at home. And also it was such a terrible political time, and the racial unrest. It was so much negative stuff that I often was talking with clients about limiting themselves and having a lot of structure about what are they going to allow themselves to do to know now what's the latest in the news, because they were hooked on, I got to know, because there was a lot going on, and we all every hour.
Yeah, you feel like you need to be updated,
right?
But I don't know if I do.
but that's exactly the thing, is reminding yourself, if I don't, like if I were on a desert island, would life go on for me on that desert island without me knowing what is going on in politics? Yeah, it would. So we've got to remind ourselves, what is my capacity to manage what that input is? And if it is, okay, I'm a little anxious hearing the 5:30 news, but it's contained. It's for about a 20-minute to 25-minute amount of news once a day. That's what I'm going to limit myself to. Then that's healthy. But if I'm constant, every hour I'm checking my phone and what's the latest, or I'm doing whatever, and keeping that going all day long, that's going to keep us in an anxious state. And we need to be wise about what's our capacity to manage those negative news stories.
You talk about how powerful basically our brains are and our thoughts are. It reminds me of, I don't know if you've listened to Arnold Schwarzenegger give his pump up speeches, or Kevin Hart, those motivational famous celebrities. They always talk about daily affirmations that they read to themselves. Like, I will be successful today. I will conquer this today. And they read them every morning.
Yes.
Daily habits, sometimes in the afternoons. And I think that feeds positivity in their life, so that they don't have time for the negative thoughts.
Yes.
I think there's something to that.
Yes, there sure is. And what I try and help my clients really focus their thoughts on, because our negative thinking often is distortion. It's something that maybe something that is actually going on, but it's a distorted, skewed way of thinking about it. And so, or just straight up negative thinking, like negative self-talk. And we talk about, all of us have this kind of tape in our head about ourselves. We might beat ourselves up. It might be from past messages from parents, teachers, coaches, peers, that we can either keep letting going on in our head, or we can shift it. So it's distortion of thoughts that we want to shift to correct thinking. So that goes along the lines of those affirmations that people are talking about, where they're declaring these positive things about either who they are or what their future might look like. And my form with my clients, I think, is like that, but it's a little bit different than those affirmations. It's more really stating and being careful about stating what is truthful, not necessarily what's in the future, like a lot of those affirmations are, but much more grounded in what is the truth about who you are. Is the truth about who you are that you really are stupid? Is that really truthful? Let's look at, what's your high school transcript like? What about your college degree? What is truthful at your work, where people are saying these messages of truth about who you are? And that's what needs to be repeated over and over again, so that your identity becomes based in positive truths about each of us, versus carrying along those negative messages that we got from others across our lives.
Yeah. How has Mike dubbed the COVID word? So he dubbed it the bubbles. So we'll say bubbles because it's the safe. That way YouTube doesn't ban us or anything when we say the word bubbles. How has the bubbles pandemic?
Wait a second.
You just said pandemic, didn't you?
Well, it's a pandemic, but
can we say pandemic?
Yeah, you can say pandemic. Yeah, we're good.
No, that's kittens.
My brain is trying to go bubbles.
Yeah.
Right.
I don't know.
You're switching out the words in your brain.
Yeah, I don't know. Why did you say bubbles?
I don't know.
I just came up with it.
That's
what he came up with.
Cute
guy. Since then, has your practice, the business, seen an uptick dramatically, or is it the same folks, or do you get a whole bunch of new folks coming in since the pandemic? because I guess what we imagine is
Yes.
the anxiety level, just everybody is, basically bursting at the ears with anxiety. I imagine there'd be an uptick. Is that not the case?
Because also, if you feel a little sick, you think you have it, and then your brain starts telling you have it, and then you start heating up. And you're like, oh no, you start sweating.
Right.
I'm telling you, your brain can tell you have it too. So I don't know. I know the brain's powerful, and I've been there a couple of times through this thing where I'm like, all right, that's it. I got it.
I got it.
Yeah.
Isn't that where all of our brains go when we are coughing or sneezing or something? You're like, oh gosh, it's coming. I'm sure it's coming. As far as an uptick, yes, I'm sure that there has been more people calling in regards to this experience of anxiety itself, as opposed to maybe people that are calling in. Some are talking about anxiety issues, some are talking about relationship issues, some are calling in about therapy regarding loss. So as far as if we were to do a graph about how many more people are calling about anxiety or depression, for sure it has really significantly increased with the pandemic having hit.
Yeah. Do you think we'll learn how to control it as time goes on? Living with the pandemic, becoming the new normal, whatever that looks like. Do you think it'll eventually subside?
I think we've all got to, right? Like it's forced upon us to learn a new way of managing this unseen enemy. And so across the world, it's not just, a country or an area of a country, but it's worldwide that all of us must learn a new way of living, but also putting a frame around interactions socially, and like us today, not shaking hands. We've got to learn a new way of saying hi and socially connecting, so that our anxiety about it doesn't stay so heightened, but that we can put it in its place as it's manageable.
Maybe some booty taps or something, like we touch each other's booties or something. A little much? No?
What?
She said come up with a new way of shaking hands.
My gosh.
Maybe not.
Maybe some chest bumps or something.
Booty taps. Oh man.
Maybe not.
That a little much.
You threw me off. I was like,
I thought you would get that.
That's funny.
Trying to save you so bad.
She said it was funny.
Yeah,
I'm
she feels that for you.
Sure. Just not so sure.
Well, Jayne, I've very much appreciated this conversation. I know you're on a tight schedule and you have to go. We would have had more time if Mike would have got here earlier, but you know how that goes.
It's my fault.
To more clients
yes.
to help out for the rest of the day.
So real quick, how can people get a hold of you and all the locations and all that good stuff of the Anxiety Center of Houston?
So that's a great question. The Anxiety Center of Houston, if you just Google that, then it'll come up. And we've got 3 locations. We've got Houston that you can click on and then see a list of therapists there that have just a summary of what each of those therapists perhaps specialize in. It has a photo of each so that you can call to the office staff and even request a particular therapist if you see one that you think that's going to be the best fit for me. But if you just call the number, and you'll get our office staff, and if you're not sure which therapist or which location, they will talk you through that and make sure that you're connected with to whom they really know from the information they have about us as therapists who is going to be a really good fit for you.
Okay. Are y'all on social media at all?
No.
No? Okay. What about you? Do you have your doctor practicing social media where people can contact you or anything?
It is just.
It's not good for anxiety.
Yeah,
There's the hint right there.
See, look at you. I
There's the
wasn't
hint
that
right
quick
there.
to say that.
He's good.
Rewind it. Let's do it again. Let's run it
Darn
back.
it. That was good. Let's put my voice over that. No, that's really good.
Oh, you don't have to change his voice. You sound just like.
That was great.
I sound like her.
Yeah. Oh God. Well, we appreciate your time, and we'll let you get out of here. That way you make your next appointment.
Thanks.
Yeah,
Thank
thanks
you
for
so
your
much.
time.
Thanks.
Bye.